We're so happy to have Dr. Susan Haas joining us now from Harvard T.H. Chan School of Public Health. And she was the course director for Work Smarter, Not Harder. How do we do this? What's your top piece of advice?
My top piece of advice for all OBGYNs is find your local industrial engineer. Now, this is something we were never taught in medical school or residency, but industrial engineering is a specialty that looks at flow of goods or patients, for example. It looks at balancing competing values, cost, quality, access. You can't have all optimized. How do you make that balance? And it also helps us predict in the future what's coming our way. Most state universities have an industrial engineering department. Many of the students are more and more interested in getting involved in healthcare. Find them, use them.
Find a student then even.
Absolutely, they're looking for projects.
A good piece of advice. So can we really improve the number of patients who are seen on time and then reduce the wait time, which is what we all want?
Absolutely. In clinic, it's helpful to understand in obstetrics that you have some patients whose duration of time in the office is going to be pretty predictable, and not very, very much. And so think about the 32-week visit for obstetrics. It's pretty straightforward what's going to happen there. But you have some patients who are going to be much longer, and you can't tell how long it's going to be. So the trick is to put the more predictable duration of visit patients first in the morning, and then the less predictable later. So you'll stay on time much longer into your day before things fall apart, as they do.
So that's not normally how we do, physicians do that now?
The way doctors think is they want the hard stuff first when I'm freshest.
Okay.
So we schedule our most complex surgeries first. This applies in the operating room as well. And we schedule our most complicated patients first.
A little bit different then. Okay. How can we predict how many patients will need admission for delivery? How do we know this?
Yes, so we typically do this by calculating the EDD, the due date, and just providing that. But we can finesse it and make it a little bit finer, and that is done by getting other aspects about the patient. So for example, we know that multips tend to deliver a little bit before their due date and primips a little bit after. On average, we're only talking about averages.
Right.
So if you added that information in, your delivery numbers would be a bit different on any week.
Now what about the peaks and the valleys on the postpartum floor volume? That floor volume, how do we manage the peaks and the valleys there?
Right. So everybody knows that it gets busier and busier through the week, and Friday is really quite terrible, and everybody's trying to get out. So most of that is from scheduled deliveries. At least 40% of deliveries in this country now are scheduled. Either they're scheduled induction, and when I say scheduled, I don't mean the emergent ones. I mean over 24 hours in advance they've been scheduled, or scheduled delivery. So if we the reason we have that rise across the week is that we schedule ourselves into that. And if we schedule the inductions differently and the cesarean repeats differently, we can level that out.
Okay. We
also can level out what time of day we discharge patients. It's hard. We have the pediatrician and the baby photo to coordinate with. We know that. But that said, if everybody goes home at noon to 4 p.m., there's going to be a huge peak, and the patients who are trying to get admitted to the floors can't get in. Interesting
bit from your seminar as well, from your course. What if we could build one less room, postpartum room, and not have to staff it either? You talked a little bit about that.
Yes. If you were designing a new facility and you had the opportunity to build one less postpartum room, the cost savings is $1 million.
One room?
One room is $1 million. And staffing a room for a year, heat, light, nursing, housekeeping, etc., is $250,000. So enormous savings from smoothing out operations and not having those peaks that you have to build and staff for.
Right. That's good motivation for learning how to work smarter and not harder, for sure. Thank you so much, Dr. Haas, for speaking with us.
You're very welcome.